Martha's Vineyard holds a reputation for beauty and wealth. But the year-round reality tells a different story.
There is a perception of what Martha's Vineyard is, and I think that most people really associate the vineyard with wealth and mansions and presidents and celebrities, but don't really understand the realities of what Martha's Vineyard is, what the community's like, what it's like to live there year-round.
For many islanders, access to food, healthcare, and housing is a daily struggle, compounded by isolation and seasonal shifts. Island Healthcare is the island's only federally qualified health center. When the pandemic deepened long-standing health gaps, the team saw an opportunity to lead.
Our motivation for applying for the RVEI grant was really seeing the inequitable outcomes that were happening during the COVID-19 pandemic and knowing that food as medicine initiatives are such an effective way to help prevent and treat chronic illnesses.
With grant support, Island Healthcare launched a vegetable prescription program, a health intervention rooted in local partnerships and trust.
When we applied for the funding, the idea was to have a produce prescription program. So basically to build an entirely new program and implement it.
The care didn't end at the prescription pad. The team built wraparound support, embedding education and cultural connection into every step.
In the wellness program, we have a dedicated interpreter. And so she was at all the classes, at the cooking and nutrition workshops, but also at the wellness classes to interpret for Brazilian Portuguese-speaking individuals.
The work focused on health, but also dignity, inclusion, and cultural responsiveness.
Bringing everyone together and meeting people where they are really builds that trust so that down the line, when we're talking about vaccines or preventative medicine, things like that, I think people are much more likely to value your opinion when you've sort of put in that work to show up in ways that are meaningful to the community.
Along the way, small adjustments unlocked big outcomes.
Sometimes you'd have a patient who would say, I live with 8 people and I don't have room in the fridge, and so I'm not buying produce because I have nowhere to store it. We were able to get them a mini fridge, and that totally opened up a whole new sort of world of access.
Behind the scenes, Island Healthcare works with local hospitals, boards of health, and grassroots organizations to build a stronger, more resilient system.
So we try and partner with them as much as we can. And actually, we're now working with them on the next iteration of our produce prescription program that was funded by this grant, which is really exciting.
Over 3 years, Island Healthcare served nearly 100 patients in its produce prescription program, and every single participant increased their daily fruit and vegetable intake.
Often doubled, which is really incredible because we know how much greater consumption of produce leads to better health outcomes.
From food access to behavior change, from community voice to clinical outcomes, the impact is real.
So there's a great example, Geisinger Health System, they have a fresh food pharmacy program. And because they have both a hospital and a health plan, they were able to do some really cool studies. And so they found that clinically, their produce prescription program had a greater impact on diabetes control than expensive medications that have big side effects. And financially, they were able to reduce the payer side costs by an average of 2/3, which is like staggering. So these interventions are so effective, both financially and on people's health. My message would be by providing fresh produce and tailored support, these programs not only address people's immediate nutritional needs, but they also foster long-term health improvements, which ultimately leads to a healthier and more resilient community and a more sustainable healthcare system.
On Martha's Vineyard, Island Healthcare is proving that rural health isn't about one size fits all. It's about building trust, responding to need, and working together. That's the rural effect. And here, it's changing lives.